Hello. In this section, we're going to review periodontal diseases. Periodontal diseases, otherwise known as gum diseases by the lay population, it is a group of diseases that affects one or more of the tissues in the attachment apparatus of the tooth, meaning cementum, periodontal ligament, bone. Periodontal disease is actually a collective name of many different conditions affecting the supporting apparatus of the teeth. What are the changes then during periodontitis? First of all, in gingiva, there is a change in color, contour, texture, and consistency. The gingiva becomes more reddened, they are swollen, the texture varies from stippled to more shiny and edematous, and consistency is buggous and edematous. There's also bleeding and some suppuration. There is also a bone loss which can be more severe around some teeth than others. There is destruction of periodontal ligament, and the cementum itself also undergoes changes. There's infiltration by plaque, by calculus, and by endotoxins. Periodontitis is more prevalent in some geographic areas of the world, such as the Far East and India. It is associated with low socioeconomic standing. It is definitely associated with smoking, with diabetes, and people who exercise poor oral hygiene. When it comes to tooth loss of periodontal disease, there is a certain mirror image that emerges. In other words, the left and the right side of the dentition mirror each other. The posterior teeth are generally lost at a higher rate than the front teeth, and the maxillary teeth more than the mandibular teeth. That's why in people who have lost partial dentition due to periodontal disease, it is more common to see a complete full upper denture and partial lower denture. As far as gender is concerned, there's a slightly higher prevalence of periodontitis among men than women. What are then the signs and symptoms? As mentioned before, there is bleeding, swollen and reddened gum due to vasodilation. There's formation of spaces between the gum and the tooth, referred to as a pocket. Bad taste, halitosis, loosening and drifting of the teeth, changes in bite, and formation of abscess. It is important to realize that in classic periodontitis, there is no linear progression, but rather a series of periods of remission and exacerbations similar to many other chronic diseases. Periodontal disease is an inflammatory process caused by the presence of plaque biofilm on the teeth. It is both a direct effect from the bacterial biofilm, otherwise referred to as a dental plaque, as well as individual bacteria residing within the pockets, and a collateral effect from the body's immune system that contributes to periodontal disease. It is important to remember that human fetus is actually sterile, but bacteria are acquired after birth, and there are more than 500 species of bacteria which establish residence in the mouth. It is also important to remember that most bacteria are beneficial, but several have been identified as pathogens. To identify pathogens in the oral cavity is a rather challenging task. It is much easier to detect a bacterial infection in a sterile environment, such as in urinary infection or blood infection. But since the oral cavity is not sterile, identifying bacterial pathogen is quite challenging. Emerging evidence from the last 2 decades shows that there is a strong link between periodontal disease and other systemic conditions, such as cardiovascular disease. The common link here is inflammation. Periodontal disease, therefore, has been associated with other inflammatory states, such as heart disease, strokes, kidney disease, preterm birth, and other conditions. How do then bacteria cause periodontitis? There are direct bacterial effects. Bacteria release enzymes such as proteases, collagenases, fibrinolysin, and phospholipase. Parts of cell walls of gram-negative bacteria are the endotoxins, which are also the lipopolysaccharides, and those stimulate osteoclastic activity, which is bone resorption. There's also the indirect effect on the bacteria through immune system and inflammation. The polymorphonucleosides via phagocytosis and opsonization spill lysozyme, the granulation, causing tissue destruction. Activation of monocytes, lymphocytes, fibroblasts by lipopolysaccharides to produce cytokines and inflammatory mediators such as prostaglandins, which in turn stimulate collagenases, destructive to extracellular matrix and bone. Cytokines and interleukins stimulate plasma cells to produce antibodies, resulting in osteoclastic activity. Tumor necrosis factor stimulates the production of matrix proteinases. So in other words, to summarize, there are two mechanisms. There is the direct bacterial effect, and there is also the mediated effect through inflammation and immunological reaction. So what does the tissues in periodontal disease look like? The fact is that they can vary from one individual to another. If you look at this image, you will see that some gums are very reddened due to vasodilation and bleed easily on probing, while other gums look darker in color and have bluish appearance.